minutes with you talking about a planned project of the Henry Ford Hospital campus. It's a new cancer center. The project's been announced a few months ago, I believe it was, and we've been working with our local neighbors on some of the planning and with the city as well, and am happy to present on an exciting project, even for just a few brief minutes here. I want to start out by talking about the mission and vision of Henry Ford, because I think that bringing a new cancer treatment center into Detroit and into this neighborhood fits very well in support of our vision to transform lives and communities through health and wellness, one person at a time. And we have some really kind of sobering statistics that I think are important to kind of show the background for the need for new cancer treatment facilities in Detroit. During the past 8 years, Henry Ford's cancer volume in general has increased 16% for outpatient services and 31% for inpatient services. In the United States overall, the incidences of cancer are predicted to increase 20% over the next 10 years. And those are really frightening statistics in a lot of ways, but they speak to the need to treat individuals where they are and the families who are affected by cancer. I think it probably includes about all of us in the room. Going beyond that, our local area is impacted even worse than some of those stats for the country and for the region and for the city. So the map up here is actually self-reported health statistics. And if you can kind of make out the geography, you can see where the darkest area is concentrated. That's where we're sitting right now. So those are folks who overwhelmingly report their health outcomes and their health situation as poor. And you can see as the further you move away from the city core, the lighter those colors get. Here are some statistics about screenings and vaccines that compare Detroit as a city very unfavorably to the state as a whole and to the counties surrounding us. And the problem that I'm discussing affects the African American community for a variety of reasons, even yet more significantly, for reasons around lack of access to care and for some genetic reasons as well. So the project that I want to briefly describe will be an outpatient treatment center for cancer that will be multidisciplinary in a lot of ways. So it will include opportunities for research, as well as a brand new transformed patient experience. So we are talking about building a 144,000 square foot building on the south side of Grand Boulevard, so across the street from the current campus, which will be the first project in a series of campus expansions that will hopefully catalyze a lot of additional growth, including residential and commercial development throughout the neighborhood as well. You can see some of the other project stats on the slide there. The project is planned to include a parking deck directly adjacent to it, to have a good connection over to the hospital across Grand Boulevard. And as much as the center will be a major benefit for the city population with advanced treatments and with recruitment of new physicians with really good reputations, this could be a destination center as well for people not only throughout the region, but even as far as internationally. The last bullet point down there is an important one too. It says disease-based program designed to optimize patient throughput and service. So what does that mean? So currently, if you've experienced cancer treatment yourselves or if a family member has, this is definitely true at Henry Ford Hospital today, the number of appointments and treatments that you go through can be pretty staggering. And that might mean, in this area, bouncing between one side of Henry Ford Hospital campus to the other, maybe over to New Center 1, maybe to somewhere else to fill a prescription. The new cancer center will be organized around disease-based programs. So on one floor, you'll find your diagnostics, your radiology, your medications, your infusion. And that means a lot for patients and their convenience, and that's good for business, but it's also really good for outcomes. So when people have to deal with the additional stress that's piled onto a family and an individual when they're going through something so difficult, the stress weighs on them and it can make them sicker. And so what we're proposing is a healing environment where the wayfinding is better, where the environment is softer and quieter and greener. And these are things that exist a lot of times in other cities or maybe farther out in the suburbs, and that's something that we want to bring to Detroit. This one's a little bit tough to read, but it talks a little bit about that patient journey. So improving the experience from the arrival through your treatment and through your departure. And you see in the middle there, it says education and research, and it says complementary care. So we have major opportunities to create spaces that are a little bit more conducive to clinical trials being performed. So if you are a complex case, we're going to have the ability to take innovative treatments to your situation more directly. Complementary care could mean things like concierge services, on-site exercise, fitness and nutrition planning, all the things that go into creating a new lifestyle or enhancing your lifestyle while you or your family member may be experiencing treatment. How many in the room have heard the term precision medicine before? Just by a show of hands real quick. Not too many. President Obama actually did mention it in his last State of the Union address. So the federal government has a precision medicine initiative that we hope will revolutionize a lot of types of care, including cancer care. So what does that include? It's a shift from one-size-fits-all treatment plans to one that is specific to you and your environment and your genetic code and what your microchemistry actually looks like, so that your treatment course is prescribed for you and will work better for you. So that means drugs that may work better, that might mean avoiding unnecessary treatments, and that's going to mean better outcomes. And we need the space to be able to do that, and we need to have world-class doctors and facilities that are going to be able to provide that type of care. A quick note on discussions that are being held with the City of Detroit right now on the construction itself. I mentioned the construction is slated for Grand Boulevard. The exact site is not determined yet because we are going through a process of planning to make sure that we end up with the most urban and dense and walkable and sensitive plan that's possible. And right now we are focused on evaluating all and any opportunities to retain some of the existing buildings in the area. So there are two church buildings, the former Sweet Home Baptist Church. Before that, it was Redeemer Presbyterian Church. And whether or not there are any ways to work those facilities into the overall plan. Like any development, there are a lot of needs that need to be balanced, including site adjacencies. So when a building in the future is built, where's that going to be located? Where's parking going to be located relative to the building? Where is the new building going to be built in connection to the current main campus so that patients and doctors can get across Grand Boulevard easily enough? So we are engaged in a process right now with Maurice Cox's planning department and Steve Lewis and Jennifer and their team to talk about how we get the best plan out of that. And then I've got just a couple of old renderings. So we'll be, throughout the planning process, coming up with some new visuals. So this isn't necessarily what the project will look like, but that is Grand Boulevard, kind of coming through the middle of the screen there. And the point is, you see a building right up next to Grand Boulevard and parking behind it. So the plan that we're working on would be integrated with the community to whatever extent possible. Zero lot line development, so not a project with a large setback and in areas that you have to walk past a lot of blank space in order to get to. We're looking for open green space public options too. So this will be a center that builds on Henry Ford and all the activity that it generates on a daily basis. A lot of that needs to occur at the street level, outside of the four walls, instead of the model where people just drive in, do their business, and drive out. So really an urban plan is kind of what we're going for. This is just a view looking in the other direction, so you can see where the current campus is and the clinic tower and cancer center across the street, right in the boulevard with some adjacent park space. So I think that's it, and I will be around for the rest of the night for any questions.